Hi students, this is Chandrasekhar, Zoology faculty from Sri Chaitanya. In Sri Chaitanya's NEET Sankalp, RE-NEET Sankalp 2.0 program, today I am going to discuss the topic reproductive health. This chapter seems to be small, but the weightage is around 3 to 4 questions in NEET. So without wasting the time, let's get into the topic. See the definition of reproductive health. The definition of reproductive health according to the WHO. Reproductive health means a total well-being in all aspects of reproduction. So what are those all aspects? Physical aspects, emotional aspects, behavioral aspects and social aspects. So physical aspects means the healthy working of reproductive organs. Emotional aspects is nothing but having the positive attitude towards reproductive related aspects. Behavioral, maintaining the personal hygiene, avoiding the risky sexual behavior, and social well-being, having the positive relationships in reproductive related aspects. So this is overall well-being related to the reproductive health according to WHO, World Health Organization. In this lesson, we are going to discuss the aspects like reproductive health problems and strategies. Here I will give you the factual information that is there in the NCERT textbook. Then population explosion and birth control. Here I will explain the contraceptive methods, medical termination of pregnancy, sexually transmitted diseases, and finally the topic is infertility. So we will see these topics one by one in order. The first is reproductive health problems and strategies. Here the factual information is India was among us the first countries in the world to initiate action plans and programs at a national level to attain total reproductive health as a social goal. For that, India started family planning program in 1951. This is the factual information. But later, this program was periodically assessed over the past decades. The improved programs covering wider reproduction related aspects with a new name called RCH, Reproductive and Child Health Care Program. So what are the two important objectives of RCH program? The one objective is creating awareness among people about various reproduction related aspects. Second one is providing facilities and support for building up a reproductively healthy society are the major tasks under these programs like RCH, Reproductive Child Health Care. With the help of audiovisual, print media, the governmental and non-governmental agencies have taken various steps to create awareness among the people about reproduction related aspects. Parents, close relatives, teachers and friends also have a major role in the dissemination, revealing the information about the reproduction related aspects. Introduction of sex education in schools should also be encouraged to provide right information to the young so as to discourage children from believing in myths and having misconceptions about sex related aspects. Proper information about reproductive organs. Adolescence is the bridge between childhood and adulthood, around 12 to 18 years age. The related changes in adolescence, safe and hygiene sexual practices, information about STDs like AIDS would help people, especially those in the adolescent age group, to lead a reproductively healthy life. Along with that, we need to educate people, especially fertile couples and those in marriageable age group, about available birth control options, care of pregnant mothers, postnatal care, after birth, the child care, mother and child, importance of breastfeeding, equal opportunities for the male and female child, etc. would address the importance of bringing up socially conscious healthy families of desired size. Awareness of problems due to uncontrolled population growth, social evils like sex abuse, sex related crimes need to be created to enable people to think and take up necessary steps to prevent them and thereby build up a socially responsible and healthy society. So this is the factual information regarding this. See, not only creation of awareness, successful implementation of various action plans to attain reproductively healthy society is required. So that implementation requires not only the policies, infrastructural support, technical support in the form of doctors and other medical staff is required. So, for the successful implementation of various action plans to attain reproductively healthy society requires infrastructural facilities, professional expertise and material support. So, these are very much essential to provide medical assistance and care for the people who are in need of reproduction related problems. What are those reproduction related problems? Pregnancy, delivery, sexually transmitted diseases, abortion, contraception. See, conception means pregnancy. Contraception means prevention of pregnancy. Abortion means termination of pregnancy. There is a difference between these three words: conception, contraception, abortion. So, about menstrual problems, infertility. So, we need medical assistance for the people who are in need of medical assistance in these related issues. And let us talk about the next concept, that is amniocentesis. Let me explain what is exactly amniocentesis. So, amniocentesis is a prenatal diagnostic procedure in which amniotic fluid which is present around the fetus is taken out. Along with the fluid, they will take out the skin cells present in this fluid. They will also take several biochemical substances that are present in this fluid in dissolved state. Okay, fine. So, what is the purpose of this, or when do this amniocentesis can be done? Generally, the amniocentesis can be done around 14 to 16 weeks of pregnancy. And what is the purpose of amniocentesis? Amniocentesis is performed to know the genetic makeup of a child. It can identify the gene disorders like Mendelian disorders. It can diagnose the chromosomal disorders, and it can also identify some of the metabolic disorders based on the biochemical substances. So, what are the gene disorders that can be identified by using amniocentesis? For example, sickle cell anemia, hemophilia can be identified. Chromosomal disorders like Down's syndrome, Klinefelter's syndrome, Turner's syndrome, these can be identified. So, how are they going to identify these disorders? Because they are taking the skin cell of a child. They will open the cell, they will see the chromosomal makeup. Inside the cell there is nucleus, inside the nucleus there are chromosomes. For example, 23 chromosomal pair should be there. If any one chromosome is extra, there is a chromosome extra on 21st pair, let us think, rather than 2 in that pair there are 3. That extra chromosome on 21st chromosome pair indicates the Down syndrome. Suppose there is a extra X chromosome on the 23rd pair, XXY. So, that is nothing but Klinefelter syndrome. So, by seeing the genetic makeup, karyotype, the chromosomal condition inside the nucleus of a cell, they can able to identify the chromosomal disorders. Of course, by assessing the dissolved substances of this fluid, they can able to identify the metabolic disorders like phenylketonuria, alkaptonuria, etc. So, this is the purpose. But one misuse of amniocentesis is, with the help of amniocentesis, the technician can able to determine the sex of the baby, whether it is XX or XY, regarding the chromosomal condition. So, amniocentesis can determine the sex, but determining the sex by using the amniocentesis is illegal. So, amniocentesis was banned for the purpose of sex determination, to control, to check, to stop the increasing menace of female feticide, killing the female fetus. So, amniocentesis is banned for the purpose of sex determination. So, these are the points related to the amniocentesis. The next topic is population stabilization. So, in this topic, we will discuss about the population growth trend both worldwide and India wide. Again, let me give you the factual information. Worldwide population. See, the world population in 1900s it is around 2 billion. Next, it is increased to 6 billion by 2000 and reached 7.2 billion in 2011. This is the population trend worldwide, but Indian population trend also followed the same pattern. See, at the time of independence, the Indian population is around 350 millions. And by 2000, Indian population is almost 1 billion. And 2011 May, according to that census, Indian population has crossed 1.2 billion. So whatever the pattern there in the world population trend for the increasing the population, the same kind of pattern is there in the Indian population. And what are the probable reasons for this kind of population explosion? So regarding the reasons, the most important reasons: increased health facilities along with better living conditions had an explosive impact on the growth of population. So one is living conditions, second one is health facilities. They are having the explosive impact on the population growth worldwide. Along with that, the other reasons for population growth includes a rapid decline in death rate, decline in MMR, maternal mortality rate, death of pregnant females, decline in infant mortality rate, death of newborns, there is a decline in that, as well as an increase in the number of people in reproducible age group are the probable reasons for increasing the population growth. Okay. See, with the help of RCH program, though we could bring down the population growth rate, it was only marginal, not having that much impact to decrease the population growth. According to the 2011 census report, the population growth rate was less than 2%, that is 20 per thousand per year. A rate at which if the population is increased rapidly, that can cause absolute scarcity for the basic requirements like food, shelter and the clothing, in spite of significant progress made in those areas. Therefore, the government was forced to take up serious measures to check this population growth rate. So, what are the measures that are taken by the government? See, to deal with this problem, they have to motivate the smaller families by using the various contraceptive methods. One more measure taken by the government is statutory raising of marriageable age of the females is to 18 years, males is to 21 years. That is the measure from the government to cut down the population growth. And also incentives given to the couples with small families are two of the other measures taken to tackle this problem, along with encouraging the contraceptives. Okay. So now let us discuss about some of the important contraceptive methods. And what are the characters of an ideal contraceptive method? The ideal contraceptive method, it should be user friendly, easily available, and it should be effective and reversible with no or least side effects. It has to be reversed. Whenever, as long as they don't want the child, they can use the contraceptive. If they want to go for the child, if the contraceptive is removed, they should get the normal reproductive cycle. So it has to be reversible with or least side effects. And it also should in no way interfere with the sexual drive, desire or the sexual act of the user. A wide range of contraceptive methods are available. The important contraceptive methods includes, the first one is natural methods, which are also called traditional methods, barrier methods, IUDs, intrauterine devices, oral contraceptives, injectables, implants and surgical methods, which are also called sterilization methods. Let us discuss these methods one by one. Under the natural methods, what is a natural method? So, natural method without using any barriers, without using any chemicals, it simply works based on the principle. That principle works to avoid the meeting of the sperm with the ovum and prevents fertilization. There are different types of natural method. The first one is called periodic abstinence, which is also called rhythm method. In this method, the couple avoid or abstain from coitus from day 10 to 17 of the menstrual cycle. What happens from day 10 to day 17 in a menstrual cycle? That is called fertile period. During that period, there is ovulation, and you know ovum will be active for 24 hours. So though ovum is released on the 14th day, it will be active for 15th day, and the sperms, the semen will be viable, active for 72 hours, around 3 days. For example, if semen insemination happened on the 12th day, that means the semen will be active for 12th day, 13th day, even for the 14th day. So that is the reason why 3 days prior to ovulation, 3 days after ovulation, the couple abstain from the coitus. That means they are avoiding the coitus during fertile period, where there is a chance of ovum release and fertilization. This method is called periodic abstinence. The next method is called withdrawal, also called coitus interruptus. In this method, the couple participate in coitus, but male partner withdraws the penis before ejaculation to avoid insemination. What is insemination? It is nothing but release of semen into the female reproductive tract. To avoid insemination, the male partner withdraws the penis from the vagina during the coitus. That means in this method, remember guys, there is ejaculation but there is no insemination. So as the semen is not released into the female reproductive tract, the chances of fertilization and pregnancy are less. And the third natural method is lactational amenorrhea. Amenorrhea means absence of menstruation. What is lactational amenorrhea? Listen carefully. In intense breastfeeding females after parturition, in the blood of that female, there are high levels of prolactin can be seen, prolactin hormone. This high prolactin can inhibit the release of GnRH, gonadotropin releasing hormone. When GnRH is inhibited, that inhibits the further release of FSH and LH, gonadotropins. And without gonadotropins, there is no follicular growth, there is no ovulation. That means in lactational amenorrhea, ovulation is prevented. And without FSH, LH, there is no follicular growth, no estrogen. That means there is no regeneration of endometrium, and further there is no shedding of endometrium. That means there is no menstruation. So there is no ovulation, no menstruation in lactational amenorrhea because of high levels of prolactin hormone in intense lactating females following parturition. But this method will be active for about a maximum of 6 months following parturition. So these are the natural methods. But what are the other points related to the natural methods? Listen carefully. There are no medicines or devices are used in these methods. Side effects are almost nil. Hence this method is said to be safe. But the chances of failure through this method are also very high, because there is no usage of any chemicals and any devices. Only it is working based on the principle, so that the chances of failure are very high for these methods. The next contraceptive methods are barriers. So the barrier methods are also working to prevent the meeting of ovum with the sperm, but there is a physical apparatus, physical barrier can prevent that meeting of ovum with the sperm. And under the barriers there are different methods. Let me divide the barriers into two categories: disposable barriers, reusable barriers. Condoms comes under disposable barriers, male condoms and female condoms. They are disposable barriers, they are for one time usage. Condoms are made up of either rubber or latex. Male condoms can cover the penis, female condoms can cover both vagina and cervix. Both vagina and cervix. See this? This is the picture of a male condom. It can cover the penis. So at the time of release of ejaculation, the semen will be released into the condom, it will be collected. So before coitus, the male partner should wear this condom. It should cover the penis. And then before coitus, female can use this female condom, so that semen can be released, but it will be released into the condom rather than released into the vagina directly. So that as it is blocking the cervix also, there will be movement of semen towards the fallopian tube. So thereby the barrier methods, they can prevent fertilization, meeting of sperm with the ovum. And one more advantage of this disposable barriers, like both male and female condoms, is very, very important. It can prevent the occurrence of STDs. It can protect the user from the occurrence of STDs. How can it prevent the occurrence of STDs? So male condom, it will prevent the direct contact of semen with the vaginal walls, because semen will be released into the condom. and as there is no direct contact and exchange of the vaginal fluids and semen, so it can able to prevent the occurrence of STDs. This is the the important point related to the disposable barriers like condoms. The example for the male condom is Nirodh. Female condoms are commonly known as femidomes. Reusable barriers. So what are reusable barriers? Diaphragms, cervical caps, vaults are the reusable barriers. So at the time of coitus they can use it, after the coitus they can wash it, and again they can use it for the next coitus. Hence they are said to be the reusable barriers. And these diaphragm, cervical caps, vaults, they are made up of rubber, and these three are for female usage only, because these barriers, they will not cover the vagina, they will cover only the cervix. So this is the vagina and this is the cervix, they are covering the cervix. As they are covering the cervix, if the sperms are released into the vagina, they will block the movement of the sperms towards the fallopian tube, so that they can able to prevent fertilization. But they are not covering the vagina. That means reusable barriers are not working and they are not suitable for preventing the STDs. Diaphragms, vaults, cervical caps, they are not useful for preventing the occurrence of STDs. Disposable barriers like condoms are very useful. And these barriers are providing privacy for the user. User can use on their own. And when barriers are used along with the spermicidal creams, foams and jellies, they will be more effective. So this is about barriers. Next, the third one is IUDs, intrauterine devices. Name itself indicates this device should be inserted into the uterus, not by the user itself. It is inserted by either doctor or expert nurses through the vagina, cervix, and it can be inserted into the uterus. IUDs are most widely accepted by the females. IUDs are the ideal contraceptives for the females who want gap between the children or who want the space between the pregnancies. These are ideal for these two purposes, and IUDs can also be used as emergency contraceptives. What is emergency contraceptive? The contraceptive that can be used within 72 hours after coitus. So even after coitus, within 72 hours, if IUD is used, it can prevent implantation, so that it can be useful as emergency contraceptive. There are different types of IUDs, like non-medicated IUDs, copper releasing IUDs, hormone releasing IUDs. One of the best example for non-medicated IUDs is Lippis loop. So what is the main function of non-medicated IUD? When it is inserted into the uterus, it can cause the local inflammation of uterine endometrium, can attract the phagocytes towards that area. Hence, it increases the phagocytosis of sperms in the uterus while they are passing through the uterus. That is the main function of non-medicated IUD. So what is the main function of copper releasing IUDs and what are the examples? Examples of copper releasing IUDs includes CUT, CU7, multi-load 375. Name itself indicates it releases copper ions. What is the function of copper ions? Copper ions suppress the motility of the sperms and decreases the fertilizing capacity of the sperms. So that means IUDs can prevent fertilization, whether it is a non-medicated IUD or copper releasing IUD. What is the third category of IUDs? Hormone releasing IUDs. Examples includes LNG 20, Levonorgestrel Gestrel 20 and Progestacert. In addition to the above functions like causing the phagocytosis, the hormone releasing IUDs are having two important functions. The first one is the hormones make uterus unsuitable for implantation. That means IUDs prevent implantation along with fertilization. And they also make cervix hostile to the sperms. It thickens the cervical mucus, prevent the entry of sperms. So when it makes the cervix hostile to the sperms, there is no proper movement of the sperms towards the fallopian tube, thereby they can prevent fertilization. So these are the examples, some of the important examples of non-medicated IUDs, copper releasing IUDs and hormone releasing IUDs and their respective functions. The main function of non-medicated is increases phagocytosis of sperms in the uterus. copper releasing, suppress the motility and fertilizing capacity of the sperms. Hormone releasing important functions, makes uterus unsuitable for implantation and makes the cervix hostile to sperms. And these are widely accepted, ideal for space between children and gap between children. Next, after IUDs, the next contraceptive method I am going to explain here is oral contraceptive pills, OCP. OCP. See this, progestogen or progestogen estrogen combination oral contraceptive pills are used by the females. These are called steroidal pills because progestogen, estrogen are steroid hormones. And what is the method of usage of these pills? Listen carefully. In the 28 or 29 day of menstrual cycle, the first 3 to 5 days is the menstruation phase. A female start taking these pills daily one within the first 5 days. So suppose she has started taking pills on 4th day, and since that day daily one pill she have to take continuously 21 days. 21 days. Around the 4th means until 25th day she has to take the pills continuously. After that there is a gap of 7 days is there. In that 7 days gap, the leftover days of this cycle like 26th day, 27, 28, 29, next cycle 1, 2, 3 days, because 4th day again she start taking. So in this 7 days gap, there is menstruation, because when she stop taking the pills, progestogen, estrogen levels suddenly fall in the blood and that causes the menstruation. Sir, how is menstruation as there is no ovulation during intake of pills? So what is the mechanism of these pills? Let me tell you. As the female is taking the estrogen progestogen combination or progestogen during follicular phase, ovulatory phase and luteal phase, high levels of progestogen compared to estrogen levels, it prevents the GnRH pulse frequency, prevents GnRH. When GnRH is prevented, that prevents FSH-LH. When FSH-LH is prevented, there is no follicular growth, there is no ovulation. But as estrogen progesterone levels are high, estrogen can cause the regeneration of endometrium. That means endometrium thickness can be increased though they are taking the pills. Once they stop taking the pills, there is a sudden fall of hormones in the blood that causes menstruation. So this is the method of intake of pills and the mechanism of pills. So overall, the pills can prevent ovulation. Pills can prevent fertilization also by altering the quality of cervical mucus. Again, the pills can thicken the cervical mucus, preventing fertilization. Pills can also prevent implantation. Ovulation is prevented, fertilization is prevented, implantation is prevented. I am talking about the pills that are steroidal in nature, And other points related to these pills are, remember guys, pills are very effective, having lesser side effects and well accepted by the females. These are the steroidal oral contraceptive pills. There is a non-steroidal oral contraceptive pill, its name is Saheli. Saheli was prepared by Central Drug Research Institute, CDRI, Lucknow in India. It is not a daily pill like normal steroidal oral contraceptive pills. It is a once a week pill. It has no steroidal components and it has no hormones in it. There is a drug called centroman is present in this. And what is the mechanism of the Saheli? The major important mechanism of Saheli is this can prevent implantation by blocking the estrogen receptors on the uterine endometrium. The main mechanism of Saheli, it prevents implantation because it blocks the estrogen receptors. Once in a week pill. It is highly effective, no doubt. Least side effects because there are no steroids are used in this preparation. So very effective and with least side effects. So name of the drug is centroman, name of the pill is Saheli, once a week pill developed by the CDRI Lucknow. Let us talk about injectables and implants. See, injectable implants also having the same composition like oral contraceptive pills, either progestogen or progestogen-estrogen combination. But what is the difference between the pills, injections and implants? I told you like pills can be taken daily, one pill. So, effective period of working is 1 day. But injections can work for few months. One injection can work for few months. One implant can work for few months to few years. Nearly 5 to 6 years one implant can work. An implant, see, this is an implant which is looking like a matchstick. It can be inserted just beneath the skin above the elbow. And it works for about 5 to 6 years. They also release the hormonal components. So, effective period of working for injections and implants is more compared to the oral contraceptive pills. But remember, IUDs, pills, injectables, implants all can be used as emergency contraceptives within 72 hours after coitus. Next, the next contraceptive method I am going to discuss is sterilization methods, which are also called surgical methods. So, regarding the sterilization methods, remember the important point, it is the terminal method to prevent any more pregnancies. Terminal method, because it is a surgical method. Next one, the reversibility is poor for these methods, and these are very effective, highly effective methods. So, the chances of failure is very low for these methods. For natural methods, failure is high. For surgical methods, failure is very low, but reversibility is very poor, but highly effective contraceptive methods. There are two types of surgical methods I am going to explain here. One is vasectomy for the males, tubectomy for the females. What is vasectomy? In a vasectomy procedure, they will make a small incision on the scrotum. Through that incision, they will reach the vas deferens. They will cut the vas deferens on both the sides. A small portion is removed and the remaining parts are tied. So, this is called vasectomy. So, vasectomy main aim is to prevent the transportation of gametes. See this, semen will not be transported, will not reach the urethra. So, what are the other points related to the vasectomy? A vasectomized male can release semen, but without sperms. So, how this male can release semen? See this, secretions of seminal vesicle, prostate gland, bulbourethral can be released during coitus, but that will not have sperms because sperms are synthesized in the testis. Those sperms are not reaching this because there is a block at the vas deferens. So, a vasectomized male can release semen, but without sperms. And vasectomy will not prevent the spermatogenesis. There is spermatogenesis. There are some misconceptions related to the vasectomy in males. One of the misconception among the males regarding the vasectomy is the males, they may think that it affects the sexual performance of the male after the surgery, but that is a misconception. And one more misconception is they are having a misconception like after vasectomy there is a chance for prostate cancer. Next, regarding tubectomy, guys. In the tubectomy, there is a small incision, small cut made on the lower abdomen, and through that they will reach the fallopian tube. On both the sides they will cut the fallopian tube at these sides. Small portion is removed and the remaining portions are tied. And it can be done by the incision or through the vagina also. One more term generally we use for a tubectomy is tubal ligation. And what happens after tubectomy? See, after tubectomy there is no fertilization because ovum it is produced in the ovary will not go to the site of fertilization. Even sperms that are released will not reach the site of fertilization. So, it is also blocking the transportation of gametes. But remember guys, a tubectomized female can ovulate. There is no surgery to the ovary, she can ovulate and she can menstruate. There is menstruation, there is ovulation even after tubectomy, but there is no fertilization after tubectomy. And what are the misconceptions regarding tubectomy? See, I just want to tell you one more point. Tubectomy cannot prevent oogenesis. There is oogenesis. Cannot prevent ovulation. Cannot prevent menstruation. But misconceptions is the females are having misconceptions regarding the tubectomy, like it may stop menstruation. No, there is menstruation. Because of hormonal imbalance, there is early menopause. Tubectomy generally will not cause the hormonal imbalance. And one more misconception is it may reduce the sexual desire. No, it is no way related to the sexual desire. So these are the surgical methods. These are the terminal methods. Reversibility is very poor, but highly effective methods, high contraceptive value. So with this I have completed the contraceptive methods like natural methods, barrier methods, IUDs, pills, injectables, implants, surgical methods, which are also called sterilization methods. See this paragraph, guys. It needs to be emphasized that selection of a suitable contraceptive method and its use should always be undertaken in consultation with the qualified medical professionals. Definitely. So while using the pills or taking the injections, implants, IUDs, they need a consultation with the doctor. And one must also remember that, very, very important, contraceptives are not the requirements for the maintenance of reproductive health. In fact, you know, they are practiced against a natural reproductive event like conception, pregnancy. One is forced to use these methods either to prevent pregnancy or to delay or space pregnancy due to personal reasons. But no doubt, guys, widespread use of these methods have a significant role in controlling the population growth. However, there are some side effects, ill effects by the continuous usage of these contraceptives. The ill effects includes like nausea, vomiting sensation, abdominal pain, breakthrough bleeding. Breakthrough bleeding is nothing but the spotting, blood drops can be seen from one menstrual cycle to another menstrual cycle in the middle of the cycle itself. Next, irregular menstrual bleeding and even breast cancer due to excess estrogen, though not very significant but should not be totally ignored. With this, contraceptive methods completed. The next topic is MTP, medical termination of pregnancy. What is a MTP definition? It is intentional or voluntary termination of pregnancy before full term is called medical termination of pregnancy. See, which is also known as abortion, but all abortions are not MTPs. There are some abortions which can occur spontaneously. Because of weak reproductive tract, the embryo may not be properly implanted. It can come out easily through the cervix and vagina. That is called spontaneous abortion. Spontaneous abortions are not MTPs. Only intentional and voluntary abortions are called MTPs done by the doctors. See the factual information here. Nearly 45 to 50 million MTPs are performed in a year worldwide. That is around 1/5 of the total number of conceived pregnancies in a year, around 20%. Whether to accept or legalize MTP or not is being debated upon many countries due to emotional, ethical and religious social issues. But Government of India legalized MTP in 1971 with some strict restrictions. So to avoid their misuse, there are some strict conditions to avoid the misuse of MTPs. So legalized MTP in India through MTP Act, that is in 1971. So why is MTP? What is the need for MTP, medical termination of pregnancy? Obviously the answer is to get rid of unwanted pregnancies, either due to casual unprotected sexual intercourse or failure of a contraceptive method during the coitus, or getting pregnancy due to sexual abuse like rapes. At that time definitely the female needs the MTP. MTPs are also essential when there is damage to the health of the mother due to pregnancy, or when a child or fetus growing is having some grave physical or mental abnormalities. When they are present, the female can go for MTP, medical termination of pregnancy. When do the MTP can be done? So during which period the MTPs are safer? MTPs are safer during the first trimester, that is up to 12 weeks of pregnancy. Second trimester abortions are much more riskier. They are risky because by that time the placenta is formed, strong connection between the uterus and the fetus through capillaries. Rupturing that capillaries causes the heavy bleeding and it may damage the uterine wall also. So that second trimester MTPs are risky. One disturbing trend observed that majority of the MTPs are performed illegally by unqualified quacks, not by the qualified professionals, which are not only unsafe but could be fatal too. Another dangerous trend is misuse of amniocentesis. So I told you already amniocentesis can determine the sex of the baby. So after once through amniocentesis, if they know that the growing fetus is a female, they are going for abortion. So frequently if the fetus is found to be female, it is followed by MTP. This is totally against what is legal. That is the reason why Government of India banned amniocentesis for the purpose of sex determination, to check or to control the female feticide. Such practices should be avoided because these are dangerous both for the young and mother and the fetus. So effective counseling is required to avoid that kind of practices. The next topic is sexually transmitted infections, STDs, STIs, also called venereal diseases, also called RTI, reproductive tract infections. Generally these infections are caused by the sexual contact. So there are STDs caused by the bacteria, caused by the protozoans, caused by the viruses. See this list. Trichomoniasis is a STD caused by a protozoan called Trichomonas vaginalis. This is a protozoan STD. The bacterial STIs includes gonorrhea, syphilis, chlamydiasis. Gonorrhea is caused by Neisseria gonorrhoeae. Syphilis is caused by Treponema pallidum. Chlamydiasis is caused by Chlamydia trichomatis. These are the bacterial STDs. The viral STIs includes genital herpes, genital warts, cervical cancer, hepatitis B, AIDS. Genital herpes is caused by a virus called herpes simplex virus. Genital warts and cervical cancer is caused by human papilloma virus, HPV. Hepatitis B is caused by hepatitis B virus, AIDS is caused by HIV. Here I want to tell you some important points, listen carefully. This herpes, genital herpes, hepatitis B and HIV, these three are the STDs, they are not curable. The other STDs, when they are detected at early stages, they are having a permanent cure, but for these three, herpes, hepatitis B, HIV has no cure. One important point is this HIV and HBV, they are STDs, no doubt they can spread through sexual contact, but generally they does not affect the genital organs of the person. You know, in HIV the Th lymphocytes are affected, in HBV the liver will be affected, causing a symptom like jaundice. And one more important. So what are the spreading ways of HIV and HBV? Listen carefully guys. HIV, HBV, both are chronic disorders. Both are STDs, sexually transmitted infections. Both can spread through body fluids like blood. Both can spread from mother to fetus. Both can spread through infected syringes, needles and surgical equipments. So from mother to fetus, sexual contacts, body fluids, infected syringes, needles and surgical equipments. So both are chronic, both are spread through these ways, and both are not curable. Both are not affecting the genital organs. These are some facts related to the STDs. See, the other points related to the STDs is the infected females. See, the early symptoms of STDs includes fluid discharge, slight pain, swelling in the genital regions. One more important point, infected females may often be asymptomatic and hence may remain undetected for long. Undetected for long. So when they are undetected for long and they are not having initially symptoms, then immediately there is a sudden complications can be arised. Next, absence or less significant symptoms in the early stages of infection and social stigma attached to the STIs deter the infected persons from going for timely detection and proper treatment. This could lead to complications. What are the complications due to STDs, advanced symptoms of STDs, very, very important. One is pelvic inflammatory disease, inflammation of pelvic organs. It can cause abortions, stillbirth, giving birth to a dead child, ectopic pregnancies, that means implantation other than uterus. Most commonly the implantation in ectopic pregnancies can occur in the fallopian tube. Of course, implantation in the cervix, sometimes even in the abdomen is also called ectopic pregnancy. Infertility. So, what is infertility? So, not having the child in spite of unprotected sexual intercourse. So, complications of STDs includes infertility and even cancer. So, these are the complications when they are not timely detected, when the disease is in advanced state. STIs are major threat to healthy society. Therefore, prevention or early detection is very important. Though all persons are vulnerable to these infections, their incidences are reported to be very high among persons in the age group between 15 to 24 years. And what are the ways by which we can avoid the STDs? The first one is prevention is better than cure. Avoid sex with unknown partners or multiple partners. Always try to use condoms during coitus. In case of any doubt, one should go to qualified doctor for early detection and get complete treatment if diagnosed with infection. The last topic is infertility. So, large number of couples all over the world including India are infertile. What is the definition of infertile? Unable to produce children in spite of unprotected sexual cohabitation. This is called infertility. There are many reasons for infertility like physical reasons, congenital reasons by birth, diseases, drugs, immunological, even psychological reasons are there. In India, often the female is blamed for the couple being childless, but more often than not, the problem lies in the male partner. Specialized healthcare units like infertility clinics could help in diagnosis and treatment of these diseases. Initially, they will give the medication to treat the infertility. If it is not corrected by using the medication, then they will go for the advanced methods. One of the advanced methods is called ART, Assisted Reproductive Technology. Under the assisted reproductive technology, there are some methods. Let me explain those methods one by one. The first is called in vitro fertilization, IVF. What is IVF? In IVF, they will collect the ovum either from wife or donor, semen from either from husband or donor, and they will take that sperm and ovum in the laboratory conditions outside the body, most like usually into the petri dish. They will allow the sperm to fuse with the ovum. So, as the sperm is fused with the ovum outside the body, this is called in vitro. If fertilization occurs inside the body, that is called in vivo, but IVF is in vitro outside the body. So, after the fertilization, zygote is formed. They will allow the, sometimes they may transfer this zygote to the female. Sometimes they will allow the zygote to divide into 2 blastomere stage, 4 blastomere stage, 8 blastomere and even more than 8 blastomeres. If they want to transfer zygote or early embryo, they should transfer them into the fallopian tube, because in natural conditions also till that 8-celled morula, it is formed in the fallopian tube and fertilization also occurs in the fallopian tube. So, if they want to transfer either zygote or embryo up to 8-celled stage, they have to transfer it into the fallopian tube. This method is called ZIFT, zygote intrafallopian transfer. Though it has the name zygote, not only zygote, embryo up to 8-celled also should be transferred in this method. Next, IUT, intrauterine transfer. If the embryo is more than 8-celled, after IVF, they will transfer that embryo through the vagina and cervix into the uterus. More than 8-celled embryo should be transferred to the uterus. That method is called IUT, intrauterine transfer. This IVF followed by ZIFT, IVF followed by IUT is said to be test tube baby program. Test tube baby program. And remember guys, one more important point I want to tell you here. This embryo transfer generally can be done after IVF, no doubt at all. But see this, embryos formed by in vivo fertilization, that means embryo formed inside the fallopian tube, also could be used for such transfer to assist those females who cannot conceive. But the point is, these embryos are transferred always to the donor or into another female. It can be done in both the ways. If the uterus of a female is suitable for implantation and for pregnancy, that means the female who have given the ovum, they can transfer this embryo into the uterus of that female. Sometimes the uterus may not be suitable for implantation. Then they will transfer this embryo to another female who is not a biological mother of the child. That female is called surrogate female. Next, the next technique is GIFT, gamete intrafallopian transfer. In this method is useful for a female who cannot produce ovum but can provide suitable environment for fertilization and further development. That means her ovaries are not producing ova, but her uterus is normal. She is unable to produce ova. During that condition, there is a method called GIFT, gamete intrafallopian transfer. What do they do in this method? As she is not producing ovum, they will collect the ovum from a donor and they will inject that gamete, ovum of a donor, into the fallopian tube of this female. Either by natural mating or by artificial insemination, when sperm reach this area, there is fertilization. But as the fertilization is happening inside the fallopian tube in GIFT, the type of fertilization in GIFT is said to be in vivo. In vivo. So, this method is useful for a female who cannot produce ovum, but can provide suitable environment for fertilization and implantation. It is not exactly only ovum is transferred in gamete intrafallopian transfer, mixture of ovum and sperm also can be injected into the fallopian tube. The next method is artificial insemination. See this point. Infertility cases either due to inability of the male partner to inseminate into the female or due to very low sperm count. Then it can be corrected by a method called artificial insemination. In this technique, the semen is collected either from the husband or from a healthy donor artificially. What do they do after collecting the semen? They may inject the semen either into the vagina or into the uterus. Injection of semen into the vagina is called IVI, intravaginal insemination. Into the uterus is called IUI, intrauterine insemination. As the semen is injected here, because male is unable to inseminate or having the low sperm count, then it will go to the fallopian tube and this female, if that female produces ovum, the fertilization inside the body, that is called in vivo fertilization. That means in artificial insemination also the fertilization is in vivo. For example, the male partner is having a severe problem of low sperm motility. Though they are injected because of low motility, they are unable to fertilize. At that time, the best method is ICSI, intracytoplasmic sperm injection. In this method, outside the body only fertilization can occur. It is a type of in vitro fertilization. They will take a ovum from the female, they will collect, and a healthy sperm from the male. They will take the sperm into a micro injection. They will directly inject the sperm into the cytoplasm of the ovum outside the body. So, when IVF naturally failed, like a fusion of sperm and ovum in the petri dish is failed, this is the best method to get pregnant, because They are not allowing the sperm to fuse with the ovum, they are injecting the sperm directly into the cytoplasm of ovum, because in majority of the cases when the sperm is having low motility, this is the best method. So these are the different ART techniques. Though options are many, all these techniques require extremely high precision handling. That is one drawback. And also expensive instrumentation, that is one more drawback of ART. Therefore, these facilities are presently available only in few centers in the country. One more drawback of ART. Obviously, their benefits are affordable only to a limited number of people. Because they are highly expensive, centers are only in few locations. Emotional, religious, social factors are also deterrents in the adoption of these methods. Since the ultimate aim of all these procedures is to have children, in India we have so many orphaned and destitute children who would probably not survive till maturity unless taken care of. Our Indian laws permit legal adoption, and it is as yet one of the best methods for couples looking for parenthood. So there is a question regarding the drawbacks of ART, potential drawbacks of ART. So potential drawbacks of ART includes expensive instruments and reagents, and less success rate because the possibility that early embryos does not survive, and less adoption of orphans. So these are the important and the availability in only in few centers. These are the important drawbacks of ART. So with this I have completed the reproductive health chapter, and weightage is around 3 to 4 questions, very important, and I have covered all the important concepts of this chapter in this 1 hour time. Thank you.